Hi, I'm Julie Hoffman, and I'm a psychotherapist here at My Therapy NYC. Today, I'm going to be discussing how to know if therapy is working for you and what you can do if it's not. So let me set the scene. You've been in therapy for a while now, but things are feeling a bit stale, or maybe you feel really energized by your sessions and your therapist is the most compassionate person in the world, but you still feel unsure about your progress. No matter how long you've been seeing your therapist or how enthusiastic you feel about therapy in general, it might be hard to track exactly what you're getting from the therapy space, or if it's helping at all. Whether you're a month, a year, or 5 years into therapy, let's talk about how you'll know if therapy is working for you. First, I'm going to ask you a question, and I'm going to give you a few moments to answer it for yourself. Is therapy helping? Keep this answer in mind as we discuss a couple of important factors that can help contribute to effective therapy and ways to know if therapy is working for you. So some topics I want to introduce are safety and connection. It's so important to feel safe in the therapy room with your therapist, and I can't stress this enough. Therapy can be a really vulnerable space, and you might be talking about memories or emotions that are difficult, confusing, or even traumatic. It's really hard to open up to somebody who makes you feel intimidated, disconnected, or not cared about. Therapy should be a comfortable space for exploration. Here's a checklist of a few questions you can ask yourself to reflect on safety and connection in the therapy room. Do you feel safe to open up to your therapist? Do you feel open to exploring things like your identity, your behaviors, your trauma, etc.? Do you feel respected and heard by your therapist? Does your therapist's office or virtual office feel comfortable and welcoming? Do you feel excited about your sessions and about your therapist? These questions are a great starting point to see if therapy is working for you. Next, let's talk about symptoms and self-awareness. Oftentimes we start therapy for a very specific reason, or we have a concern, like a symptom or a life event that we want to explore more. For instance, things like, I can't focus at work, me and my partner are fighting all the time, I want to know myself better, I want to come out to my parents. However, lots of people start therapy for much broader reasons, like maybe somebody told you that you should go, or you heard how beneficial it's been for a friend, and you want to check it out yourself. All of these are appropriate reasons to start therapy, but they might all look completely different in terms of how you approach therapy or how your therapist works with you. Whether you're in therapy for something big or something small, it's really helpful to gain some self-awareness as to why you're seeking therapy in the first place. Here are some questions you can ask yourself to get a better sense of what's motivating you in therapy. What got you interested in therapy? Why therapy and why now? And that's a question I ask all of my real-life clients during our first session. Can you identify what you've been working on in therapy? Can you identify what you've learned about yourself, about the world, your patterns, your coping skills? Have your symptoms improved since starting therapy? And are you feeling better, or are you feeling more stable than before? Knowing why you choose to go to therapy every week can help you understand if therapy is working for you and can directly lead to setting yourself up for success. Which leads me to my final checkpoint, goals. Setting goals for therapy is important for so many reasons. It helps you feel clear, direct, accountable, motivated, purposeful, and overall just gives you a sense of working towards something, which to me is such a great feeling to have. Not only does it help you to understand yourself, but it helps your therapist get a better sense of how they can work with you and be prepared for your sessions together. It also allows for both you and your therapist to check in on these goals together throughout your treatment and either redirect or continue forward according to how it's going. Here are some goal-oriented questions to ask yourself. Do you find yourself only using therapy to vent? Do you have goals for yourself? Have you spoken with your therapist about your goals? Have you created a system with your therapist to check in on your progress? And does your therapist check in with you about your goals? Hopefully, after reflecting on all of this, it's clear that therapy is, in fact, working for you, and that's amazing. But it's also completely possible and okay if it's not. Now I'm going to shift gears to discuss what to do if therapy is not working for you, or if you just feel a little bit stuck. First, you should explicitly define what's not working for you in therapy. The issue could be as small as scheduling, and you need to find a better time to make it to your consistent sessions. But there could also be a much bigger dilemma that prevents you from feeling like therapy is helping. Remember that it's important to feel safe, comfortable, open to trying new things, willing to implement new skills, and to have clear goals and direction. There are just so many parts of therapy to consider, and each one is worth exploring to see what's not working for you. Now that you know what's not working, it's time to talk to your therapist about it. Your therapist really wants to help you, but doesn't have all the answers, and they can't read your mind, although it would be really cool if we could. It's helpful to think of your therapist as a helper and a guide, but not as a fixer. Remember that therapy is collaborative. Let your therapist know what's missing, what you need more of, and what's not helping. They can help find new ways of approaching your sessions together to get back on track. We talked about setting goals before, and now that your therapist knows about your concerns, now is a great time to refresh your goals in therapy together and to discuss expectations for what your therapist can actually provide to you. For instance, maybe you're seeking medication or a diagnosis in order to access different types of resources. Some therapists just can't provide these services. Maybe you have a goal of working specifically on substance use or an eating disorder, but your therapist specializes only in anxiety treatment. Although many therapists can help you with many different things, it's possible that what you're seeking is not aligned with what your current therapist can offer. As a reminder, progress in therapy could be hard and might be slow going, so be patient and open with the process. Be realistic that change cannot happen overnight and requires consistency, connection, continued effort between sessions, and a willingness to try new things. Building goals with your therapist can help you figure out if you want to change course, focus in, or even bring somebody new onto your care team, like a psychiatrist, a primary care physician, or a registered dietitian to help with different parts of your wellness. After having an open conversation with your therapist, you might find that your therapist just simply isn't the best fit for you. Remember that you deserve therapy that feels good and accessible, and there's no shame in stepping away from a therapist and starting fresh with somebody new and more aligned with your needs. It doesn't mean that therapy can't help, it might just mean that you haven't found the right fit yet. Things like identity, personality, expectations, style, and price are all components to consider when searching for your therapist. If you feel that it's time to look for somebody new, be open to talking with your therapist about your time together. They might be a great resource for referrals and can help you find what you need. In conclusion, it's so brave to be working on yourself in therapy. And with that said, it's also important that you feel like therapy is working for you. With all the time and resources you put into the therapy space, you deserve to utilize therapy as a tool and to be able to lean on your therapist as a source of support and comfort. Don't give up if you feel like therapy isn't working. Instead, like we talked about, you can define, discuss, set goals, and start fresh if needed. As I start to close down this discussion, I'm going to ask you the same question as earlier. Is therapy helping? Hopefully, you now have a clearer answer and understanding of your own therapy journey so far. Feel free to comment below what takeaways you have from this video and how you will know if therapy is working for you. Thank you so much for tuning in, and for more information, you can check out our website at mytherapynyc.com.